Our private mammography area houses an ACR accredited digital mammography unit that is staffed by certified technologists. Images are interpreted by Spectrum Medical Group, the same radiologists who read for Maine Medical Center. Thank you for choosing Coastal Women's Healthcare for your breast health. A mammogram is the X-ray picture of the breast. The X-ray makes it possible to detect any abnormalities that can't be felt. There are two types of mammograms. Screening mammograms are utilized to check for breast cancer in women who have no signs or symptoms of the disease. Diagnostic mammograms are utilized to check for breast cancer after a lump or other signs or symptoms of the disease have been found by the clinician or by self-exams. A diagnostic mammogram can also be used to evaluate changes found during a screening mammogram. The American Cancer Society recommends mammograms at the age of 40 and continuing yearly as long as a woman is in good health. When you call to schedule your mammogram, please be sure to tell your scheduler if you have breast implants, as this requires additional time. It is helpful to wear a two-piece outfit so you will only have to remove from the waist up. Please do not wear any deodorant, lotion, or powder on or under your breasts or arms, as this may cause a need for unnecessary VP images. You may schedule your mammogram at any time. However, if your breasts are tender during menstruation, it may be helpful to have your exam 1 to 2 weeks after the start of your menstrual period. 2 to 3 views will be taken of each breast. The mammographer will slowly compress the paddle on top of your breast, spreading out the tissue. This will allow the technologist to obtain a clear image of your breast using a low-dose radiation. Your breast will only be compressed for a few seconds, and the mammographer will work with you to ease any discomfort you may have. The radiologist who interprets your images are members of Spectrum Medical Group. They will analyze the images and send a signed report to your referring physician and/or primary care physician. If a follow-up mammogram is not necessary, a letter will be sent in the mail stating your recent examination was normal. If you do receive a phone call from us to schedule a follow-up mammogram, it does not mean you have breast cancer. It only means that the radiologist would like further imaging to evaluate a specific area within your breast. A screening mammogram is usually covered by most insurance carriers yearly at the age of 40. You would need to call your individual insurance company to find out if covered at no cost to you or if it goes towards a deductible or co-insurance. The codes are G0202TC and 77052TC. Keep in mind that the radiologist who is from Spectrum Radiology also bills your insurance for the reading of the mammogram. A follow-up or callback mammogram is considered a diagnostic mammogram, and it usually goes towards a deductible. To find out how your insurance plan would cover these, you would need to call and give them the codes 77051TC G0206 for one side only, or G0204 for both breasts. Again, the radiologist from Spectrum Radiology will bill for the reading of this mammogram.